week.
It's part of my compensation package, buddy. Thank you for paying my way. I appreciate that, Derek.
Pay for your week's vacation.
I thank you guys every morning, whether you hear it or not, when I give my moment of gratitude. Do you give a moment of gratitude, Derek?
Do I feel it? No, not at all. But, you know.
Does anyone?
Oh, wait. Do we have one?
Do you give?
Huh? Do you give a moment of gratitude frequently?
Oh, yes. I thought you said did not feel your gratitude.
Well, that too. I mean,
Not really.
not really. So I owe a couple of people a steak dinner. I haven't made you the bet yet, but I've got a couple to buy now. If this class passes the National Registry on everybody in this class who gets a course completion certificate from Emily and myself, you know, you're done here, you're eligible to take the registry. Of all those who get that certificate, and I expect at the moment I'm not too sure.
Oh, no.
If you get one of those and you pass the registry on the first time as a whole, 100% pass rate on first attempt, I'll buy all of you a steak dinner.
I'm gonna get some milk.
I kept that cow. She's in the freezer.
That steakhouse.
Now, some people stare. It's like, I'll just be good with a bologna sandwich, dude.
Wait, I will take it.
He's got gratitude.
I bet your account.
He's got gratitude. Okay, let's get back to it. I don't know who came up with this. It sounds catchy, so I guess who first said it, it stuck, and probably an EMT student somewhere says, that sounds like the deadly dozen. I've seen this in so many textbooks, and I don't know the origin of it. Not that it matters, but it works, so let's run with it. These are chest injuries that kill you. Now let's go through them one by one and talk about them. And if we do, we pretty much have this chapter wrapped up. Airway obstruction. Trauma-related. Talk to me about airway obstruction. Huh? Swelling of the tongue due to smoke inhalation. Okay, that's trauma. That's heat transfer. Huh?
Is a bee sting kind of trauma?
I mean, yeah, it's pretty traumatic.
Come on, Frank. Work with me here, okay? Does it? Does it?
It's a medical
Tissue damage.
It would be traumatic to me if I took a drink of my Dr. Pepper and there was a bee in it. It would be pretty traumatic. But it's not a transfer of energy. It's a transfer of toxin. So let's put that in toxicology. Let's give that a third category. But yeah, sure. What else? Impelled objects in the airway, causing the airway to be obstructed. Like the old famous number 2 pencil in the cheek, which I've never seen happen, but I guess somebody's done that once. What about biting a steering wheel? What about a clothesline injury? What we call clothesline injuries, where you're riding a horse or a motorcycle or an ATV or a golf cart and you strike a limb or strike a wire, a clothesline that mom has put up or something like that. That would certainly cause some trauma to the oropharynx, cause the swelling of the neck, stuff like that. Swelling secondary to a laceration, sure. I don't have a problem with that. Let's get out of the neck for a minute. Is there anything in the chest? Because it says chest. Is there anything in the chest that can be obstructed, that cause airway obstruction? The tension pneumohemothorax kind of thing, pushing it over, kink in the trachea? Sure, yeah. That's an extreme example, but it certainly is one.
Getting smashed in general.
Getting blunt force trauma to the chest, causing the trachea to swell? Sure. Busted clavicles, secondary swelling. You think of anything else?
Varices?
Esophageal varices. That would probably be more on the medical side, but yeah, it would be in there. New word alert. If I could think of the word. I had the word and then I was like, nope, that's a different definition. Let me work my way through this. Let's see what this word is. I am. Idiopathic. What's idiopathic mean? Stupid? What's it mean to be stupid? You can't say that. Ignorant? What's it mean to be ignorant?
Not know something.
Not know something. To be idiopathic, it means the cause is not known. Patho, pathogen, pathos, disease, idio, like seizure disorder called epilepsy is a seizure disorder with no known cause. So it's an idiopathic cause. I'm trying to really spark my memory here, and I'll probably have Alzheimer's or something. I don't know.
Type 3 diabetes?
Could be. Idiopathic. All right, Amber, help me. It's the word caused by some issue. It's the word related to an issue caused by the medical practice itself. What is that word?
Was that omission or commission? Something like that?
No,
Is it an airway obstruction word?
it can be.
Ask it again.
It is a issue caused by the medical practice itself.
Negligence.
Its cousin is idiopathic. Stupid. I got it. Whew. The Rolodex is full. Iatrogenic. I mean, hell, that was a little bit hard to think of, Gus, all right? Am I right?
Yeah,
Yeah. You mean I'm faster than Google?
and then ChatGPT, yeah.
Oh, ChatGPT, got it. Iatrogenic. Iatrogenic is caused by the practice of medicine. And as that relates to airway obstruction in a trauma patient, if you get a paramedic or an advanced EMT that's doing some intubation, or a physician doing some intubation that is less than good, they can cause an airway obstruction themselves. So I have followed up other paramedics who were less, when I say less skilled, I'll be blunt with you, they were less skilled. They weren't skilled at all trying to do an airway and intubation, and they just traumatically destroy my oral pharynx that I'm supposed to intubate. It's like, this probably looked real good till you dug around with that laryngoscope for 10 minutes. There was a physician in the Bonham Hospital that I went behind, and she had dug in the airway to the point where she dislocated the man's jaw and broke out his front teeth by prying back on the laryngoscope. She had no business running that thing. She was not skilled at all in her practice. Those are iatrogenic causes of airway obstruction. They're caused by the medical people themselves. That little light bulb that used to be on the end of laryngoscopes, now they're kind of fiber optic and stuff. But we used to have little light bulbs on the end of them. And right around the ambulance for 10 days before you ever got it out, the light bulb would get loose and you open it up and sometimes the light bulb would fall in their mouth. That's an iatrogenic obstruction. So the term iatrogenicity means caused by you in the medical community. You didn't have an infection in your body till you went to the doctor and you picked up the infection from the doctor's office or the clinic or the ER or something like that. That's iatrogenic. Bronchial disruption. Chas, give me an example of a scenario. Give me a scenario where a patient could suffer from a bronchial disruption. That would be a tracheal disruption, but you're close. Being choked by a hanging type injury, maybe. Pulls up on the trachea from a hanging, maybe. Give me another one. Luke, can you think of one? I see the wheel spinning.
Is this just traumatic?
Uh-huh. What mechanism of injury could give me or give your patient bronchial disruption? Maybe we should define it first. What is that?
Say like tear gas.
That's toxicology too. That's over there with Frank's bee sting. What is bronchial disruption? Maybe I'm putting too much faith in the wording.
It's just disrupting the normal,
Well, what's that?
the narrowing of the.
Okay. Bronchial disruption means it's torn up. The bronchial tree is torn up. It's disrupted. It's not intact. Now, with that being defined, give me a mechanism of injury that would possibly lead to bronchial disruption.
Stabbed.
Knife to the chest. Okay, you could literally cut it open. That would be an open chest wound. Blunt force trauma is what I'm thinking of. Those heavy water-filled, fluid-filled, air-filled lungs, they're kind of heavy and they slam forward at 70 miles an hour. Remember that third collision in a vehicle collision? The third one? But the bronchial tree being kind of rigid, it pulls apart. What signs and symptoms would you see with that? Do what? Pink frothy sputum? Okay. Let's give a new word for that, shall we? Since that's more of a CHF kind of lingo. Let's talk about what you would cough up if you had bronchial disruption. Would it be blood? Blood and tissue? The word for that is hemoptysis. What the? Hemoptysis. 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 Coughing up blood. I didn't write it down. Hemoptysis. Hemoptysis. Coughing up blood. What else?
Is that blood and other stuff or just blood?
Yeah, let's just go with blood. What else? Uh-huh. What else would they, how else would they present? Dead? Okay.
Trouble breathing?
Oh, yeah, that's probably pretty good. So dyspnea, right? Okay, dyspnea.
Wouldn't they have kind of wet lung sounds?
Would they have wet lung sounds as blood started filling the alveolar space? I don't see why not. Do you? How about dull to percussion? How about dull to percussion? Instead of resonant, dull. Not hyper-resonant, but dull. Fluid filled. If you want to go there. Okay? Yes. Poor general outcome. Poor general outcome. So there was this old girl that wanted to do suicide one time, and she thought she'd be really cool in doing this, and she would run a skill saw across her wrist. Well, she didn't give it the full old bear down and let it cut. She just kind of skimmed across top of her wrist, and she's like, that didn't do it. So she put it in the other hand, did it the other way, kind of the same thing. It didn't do it. Because she's not like just bearing down on the saw. If you wanted to cut your wrist off with a skill saw, you'd have to like, she just kind of, she knew it was going to hurt. And she like, well, that didn't work. So she took the guard and peeled it back, started the saw, and went, phew, right here, right on her belly. Eviscerated her belly. Guts came out.
She's still alive.
Still alive. Well, she sucks at this. Not to make fun of her, but I mean, it's crude in this room anyway. She takes it and puts it on her neck. No, it's like the skill saw, the blades right here. Didn't kill her, so she pulls it up and says, this will do it. She cuts her trachea. still alive. By this time, she is found and she's lying on her back. There's obviously blood, but she hasn't hit the big ones.
Should have went from
But
the side.
she's pulled her trachea open.
Dude, she did a freaking tracheotomy.
The paramedics come in. When they get there, they intubate her. They put the tube through her mouth. One paramedic takes the larynx and lines it up where it should be, and the other paramedic says, "You got it," and he pushes the tube on down and seals it off down in there, and she lives.
R.I.P.
That's right, you just stuck those intestines back in. I'll be back.
Well,
Skill set.
the intestines were the least of her worries. So these clothesline injuries I speak of, or these hanging injuries, or these distraction injuries. There was a kid riding a go-kart one time, and he never had ridden a go-kart before, and it was Christmas morning, and Santa Claus brought him a go-kart, and his dad went out there and started it, and he took off and he ran right into the bumper of the truck. He died on Christmas morning by cramming his face into the bumper of the pickup truck on a go-kart.
I got more real quick.
Well, it does, doesn't it? Welcome. Glad you're here. Glad you're here.
It's been a fast go-kart.
Yeah.
Fast enough.
When I worked at the sawmill, this
Put a
kid
helmet on.
tried to reach in and grab these chippings from where the blade was at.
Not
Blade's been
probably
so
wasn't real
fast,
smart,
he
was
couldn't
it?
see the blade. He was at, he caught his hand in there and it got all jumbled up. Well, he went to Mayo in Arizona, that's where he happened at. And he took his hand and then he stuck it inside of his stomach.
To grow back. Yeah. So it'd get a blood supply. Yeah, they often do that when they reattach. They stick it somewhere else in your body so it gets a good blood supply. Like the end of your finger will go into your palm, or your hand will go into your abdomen, just to get a rich blood supply for healing.
It didn't work. He lost his hand.
Didn't work, huh?
They call him Cat.
People who come up out of the seat and hit their neck on the steering wheel will get these bronchial disruptions, esophageal injuries, and things like that. Moving on along, diaphragmatic tear. So what does that mean? Hunter? The diaphragm is torn, guts come up, and at the same time it can't pull down for respiration. Give me a injury or a MOI that could lead to that. Well, give me an injury that would make you suspicious of that.
Blunt force trauma.
Be more specific.
Car wreck.
Boxing, shovel punch.
The steering wheel goes into their stomach or the seatbelt.
Deceleration, taking a blow to the chest.
Could barrel trauma do it?
Could barotrauma. You need to define that. If you're going to speak that language, dude, you got to define it. A change in pressure. Everybody know what barotrauma is? Barotrauma is a change in pressure. Absolutely. Can you be even more specific?
You're in the zone where I guess a bomb.
Okay, the blast zone.
Yeah.
Which part of the blast zone is that?
It's the second one, right?
The primary or secondary?
Primary.
Primary is the blast wave coming across. Can I give you another one, Billy? So you're a scuba diver, and you go down and you're looking at the fishies and all this stuff, and you're like, something's wrong. Oh, hell, I'm out of air. I thought after the alarm went off, I'd have another 20 minutes, kind of like my wife on E. It says E for a reason. E means empty. Not exercise your luck. It's empty. So the scuba diver, for whatever reason, runs out of air, and he or she takes their last breath at depth. 70 feet underwater, holds their breath. That's what I would do. That's why I didn't like scuba diving, because my instincts always seem to override what I should do. And what you should do when you go up is let your air out as you ascend. But your instincts say hold your breath because you're underwater. It's a bad idea because you're 70 feet underwater and the air is compressed when it's down there, and it's compressed in your lungs, but as you ascend, Boyle's law, I think it's Boyle's law, the air expands, and as it's expanding and you're trapping it, it's going to expand, and that's barotrauma. It could blow the lung apart, it could blow the diaphragm apart, it could blow the neck apart, and it could kill you by holding your breath. So you're trained in that over and over and over. When you ascend, blow out.
It's also 15 minutes. You go up 15 feet, wait 15 minutes,
If you got one of those planned ascent dives where you go way beyond recreational. So yeah, barotrauma, Billy. Esophageal injury. This is our varices. You've already prone to varices, or you have varices, and you take a deceleration injury, or you get hit in the neck and that thing starts bleeding ferociously, or you've got an esophageal weakness. The esophagus runs down to the top of the stomach. It's got another sphincter there that keeps stomach contents from going back up the esophagus, called the cardiac sphincter. And people get that messed up. People with GERD, esophageal cancers, things like that. So it doesn't take much trauma for that to peel off or bust off. Or you could just be riding around with a really full gut, really full stomach after a heavy meal and decelerate into the bridge, and that heavy stomach pulls off of the esophagus. What's going to happen, do you think? Nate, what's going to happen when the stomach gets torn from the esophagus? In other words, we've lost the cardiac sphincter to hold the contents in. It's going to spill out. What's the pH of the stomach? Any idea? Can you guess the pH of the stomach?
probably higher than, probably low, it's like 3.4, 2.4.
It's low. It's down there with battery acid. It's in the 2s. It's a very strong acid. So when those contents and all that acid spills out, it's going to actually start eating on you. It's going to digest you from the inside out. Will it kill you immediately? Maybe not. So how would that present? What would the presentation be like? Could be smell, could be pressure in the chest, inability to swallow,
Big stomach.
blood,
Cold when the stomach comes up through the
distension.
What would that sound like?
Could you hear the acidity?
No, but it'd be working. It would be working. I've never heard one, but I'm not going to say you couldn't hear it. I bet you could feel it. That'd be heartburn like hell, wouldn't it? Literally heartburn. Some people who have GERD over on the medical side, that thing can leak slowly over time and burn a hole through the esophagus and burn a hole through the aorta.
Let me ask you this, do you take that to the burn center? Is that considered burn?
Nope. Thoracic surgeon. Open them up, evacuate the contents, debride, seal back up, try to put it back together. But these are the ones that'll kill you. So it's probably deadly. Open pneumothorax and tension pneumothorax. And I drew a picture on the board during break. Somebody asked me to show them this, and I did. So this lung is being collapsed, or is collapsing, and that's what people in the public say, got a collapsed lung. Well, we say we have a pneumothorax because the air is now in the pleural space and filling that up, collapsing that lung. This is an open pneumothorax because there is an open sucking chest wound to the outside. A spontaneous pneumothorax would be a tear in the lung lining causing this with no opening out here. If that air starts to get trapped and builds and builds and builds and pushes this over to the uninjured side, then it becomes a tension pneumothorax. And we've just went through what that looks like. Tracheal tugging, JVD, absent breath sounds on the affected side, or at least diminished, poor perfusion status, shortness of breath, and the list goes on. The nice thing, if there is a nice thing about a tension pneumothorax or an open pneumothorax, those are filled manageable. Not by EMTs, but by paramedics. A lot of this airway obstruction, depending on what it is filled manageable. Bronchial disruption, no. Tear, no. Esophageal, no. 5, 6, yes. Those should be filled manageable by ALS teams. So keep that in mind when you see one, hey, I need ALS here, or I need a trauma center quick. I would not rely on, boy, I hate to say this, I hate to think that we live in a country that this is true. I would not have any faith in a non-trauma hospital fixing that. There are some physicians who are working as ER doctors in low acuity ER facilities that would probably not be able to manage a tension pneumothorax. As simple as that is.
What would ALS do? Would they intubate?
They would relieve the pressure. They would perform what's known as a needle thoracotomy. It's making a hole in the chest or the thorax, thoracotomy, hole in the thorax, with a needle. And they go over the third rib in the second intercostal space, over the third rib to avoid that neurovascular bundle. And they stick a needle in there. If you're around, if you're assisting that paramedic when he or she does that, stay clear. Because once they puncture the pleura space, you're going to relieve that pressure. So you're going to get a shot of fluid or at least air coming out of that. Should, if you've done it right. If that's what it was, you've done it right, you should. Dr. Lewis, your medical director, Dr. Lewis, is constantly researching and exploring the idea of a finger thoracotomy, which is taking a sharp instrument and cutting a slot in the lower thorax and taking your finger and going there and puncturing that pleura and feeling around, and that way what's probably down here that's not up here?
The liquid.
The blood. And so you get to evacuate the blood. If blood is in that space, it is called a hemothorax. Hemothorax is blood in the pleural space. Ding, ding. So what is a hemopneumothorax?
Blood and air.
Blood and air in the pleural space. And they both have to be evacuated. And I would not rely on a non-trauma hospital to be able to do that. Even though I'd hate to also pass a hospital without calling them and say, hey, I've got a hemopneumothorax here. Can you handle this? I know some physicians personally who would say, hell no. It's kind of sad. Billy.
So, hemothorax is blood in the pleural cavity.
Uh-huh.
And what's it called when you have blood in the lungs, though?
Blood inside the lung itself. With trauma, I'd probably still call it a hemothorax. I wouldn't call it anything any different. Because it's probably going to be in there as well. You know, by definition, you'd be correct. Blood in the thorax, where it doesn't belong. And I think you're onto that, Billy, pretty well. If I've got an injury that makes blood pool in here, there's probably blood pooling in here too.
So you stick the guard in as a paramedic in the upper part, and you get nothing, but you still believe it to be a hemo. Do you then start lower to get the blood out?
If your protocol will allow it, that's perfectly within the scope of practice of a
Or
paramedic.
you turn them upside down.
Or you turn them upside down, let it run out. There you go. There you go. Well, think about it like this too. How are they probably going to be transported? Supine. Most likely this trauma patient's flat on their back. Still, I don't know if you get a return of blood. And you guys work in the ER. Y'all seen chest tubes. When you see chest tubes, that's what I'm talking about on a finger thoracotomy. If you get bored later today, look up on YouTube. There's a gun. I can't think of the name of it. It's a trade name. It's new. It's just been invented, and it looks like a toy water gun kind of thing. And it actually has a handle and a trigger, and it's got an arrow on the end of it. And you put that up to the patient's chest and pull the trigger. And this device punctures in there, and then you pull stuff out, and when you pull it out, it inflates a bulb on the backside, and you basically just inserted a chest tube with this device. And they're trying to get that. They're trying to market it saying it's going to save so many lives. Have you heard me say 1,000 times? If we got blunt force trauma to the chest, we usually don't resuscitate if they're in cardiac arrest. If you pull up on scene and your patient has blunt force trauma to the chest, not impaled, but blunt, and they are in cardiac arrest, most protocols will say, cover them up, don't work them. Do not attempt resuscitation. There have been enough people that have been brought to the ER where the doctor did the thoracotomy and they gained their pulse back. The reason you can't feel the pulse sometimes in those patients is because the hemothorax or the tension pneumothorax is so severe that it's totally kinking off the blood supply to the heart. So if you can restore that, if you can return the blood flowing to the heart, maybe they'll regain their pulse. And that's happened enough for people to say, you know what, we need to stop just writing off our patients in the field that are in arrest. As a last resort, before you pull the sheet over them and say, next, why don't we attempt this? What have we got to lose? We were writing them off anyway. Are you following along with my thought process there? Why don't we just go ahead and try this? And if it works, great. If it doesn't work, we were covering them up anyway. And that's what Dr. Lewis is kind of playing with. You get out in remote areas of Cook County, way out there in Munster and stuff. You don't have an ER that's trained to do this, and you need to go to a trauma center down in Denton or Plano or back to TMC or Wichita Falls or something. You can certainly see why he really wants his paramedics to be able to do this. Let me give you the secondary reason it hasn't been done yet. How do you train on it? The best model to train on is pigs. But how do you go to a slaughterhouse with a bunch of paramedics to train on this? And what would happen if word ever got out that, hey, they're practicing on pigs? And they are in a controlled research institution. You see the point. Now you could get a slab of rib meat out of the store and do it, but they kind of lose its effectiveness to train that way. You ever heard of the robotic surgery? The robots in surgery? I know a pig farmer. And this pig farmer had a whole bunch of pigs, and the hospital called him and said, hey, we need 10 pigs. You got 10 pigs? He said, yeah, how much? He's like, I don't know, what do you want to give? He said, just tell us how much and we'll write you a check when you get here. We'll have a check ready for you. And he told them, he said, I just charged them. And they didn't argue 1 minute. He's like, I'd love to sell pigs to the hospital. So he delivered. They said, you got to be here at 3 o'clock in the morning, though, and come to the back door. And he backed up to the back loading dock, and they had these carts. He's like, what are you going to do with these pigs? And they went in there and gave them injections, and all the pigs started falling over. And they took the pigs off on the carts. And they said, you got to come back later. He's like, no, well, for what? And he said, to get your pigs. He's like, they're your pigs. He's like, no, we're paying you to use those pigs. We're going to pull their gallbladders out. And we're going to do it with the robotic surgery. We're training our surgeons on the robots. But don't tell anybody. And he went back and got his pigs, and they were all alive and healthy and walking around with little bitty incisions on them because they used the robots to go in there and pull their gallbladders out.
What do you do without your gallbladder?
Burp. Burp a lot. You can live without your gallbladder. But a lot of people have it removed. Do you know what that's called?
No.
A gallbladderectomy. Come on now.
Respect.
You were about to say that? It's not what it's called.
What the heck?
What's the inflammation of the gallbladder called? I taught you this. I taught you this. This is a chest pain imposter, remember? Cholecystitis.
Yes, it was in the
So obvious too.
I knew it.
Cholecystitis. So Luke, your challenge. What is removal of the gallbladder called? You don't have to tell me right now. A cholectomy? All right, moving on along. Flail chest. Why is it deadly? No tidal volume. Is that field treatable? Could be. Very well could be. If left unrecognized, then it's deadly. Cardiac tamponade. Spend a little time here. Cardiac tamponade. So did the lung set in a sac? And that sac was called the pleural sac. Does the heart set in a sac? What's that sac called?
The perineum section.
No, that's the area between the genitals and the anus. The pericardial sac. I mean, come on, Gus. Pericardial sac. Riley knew it. She just didn't want to say. Pericardial sac. Okay, so we got the first part of that figured out. Now let's go pericardial tamponade. If the heart's setting in a sac, and it has a visceral and parietal too, by the way. There's a parietal pericardium and a visceral pericardium. Which one would be on the outside? The parietal. So it's setting in the sac. You think there's fluid in that sac to keep that heart lubricated in that sac as it does this little thing all the time? It's called pericardial fluid. Can we get an excess of fluid in that sac? We can, from one or two mechanisms. Number one, we can have infection. This is very common in patients who have HIV. It's common we saw a lot of it in COVID after the vaccine. So young people who took the vaccine often got this inflammation of that sac. You see it in transplant patients. That's called pericarditis. That's inflammation of the pericardial sac. And the excess fluid is pus. In trauma, the excess fluid is blood. So when those arteries that are on top of the arteries and veins and capillaries that are on the surface of the heart leak, and they start filling the sac up with blood, there's less room for the heart. And so the heart is tamponaded, meaning it's squeezed off. And now the heart can't fill fully because it can't expand. Why can't it expand? Because it's tamponaded or constricted in the sac. You will recognize this by what's known as muffled heart tones. When you're listening to the heart, it will sound like you're listening through a bucket of water. They will be muffled. Like plug your ears and talk. That's what it sounds like. Muffled heart tones. It's a deadly thing. So you think blood pressure is going to go down? Not only will it go down, you will have ding ding, narrowing pulse pressure. Your top number and your bottom number, systolic, diastolic, will get closer and closer and closer together as the heart is less able to expand. If it can't expand, then it can't fill up. If it can't fill up, then the blood backs up. And do we get jugular vein distension or JVD with this as well? Yes. So think blunt force trauma to the chest, bam. You have the Chevrolet bow tie in your sternum, the imprint, or the 4 little circles from the Audi. You get the point? You listen to the heart and it's muffled. You take the second blood pressure, the numbers are growing closer together. You get to looking up, and now this guy setting up in a car has actually got JVD starting to go on.
Were you getting your blood pressure reading or like sign?
Well, you'd have to repeat it to even know if it was narrowing. I had to be just highly suspicious of it, and probably the fastest way to determine this is they look poor. They look like crap. You got a mechanism of injury, it was a blunt force to the chest. If you're on a blood thinner, even worse, right? And you listen to the heart tones and they're muffled. And then you can follow it with your blood pressures as you repeat them and their numbers getting closer together. This is not managed by the EMT other than rapid transport. It can be managed by a paramedic, but I haven't seen a protocol that allows it, even though it is in the scope of practice for a paramedic. What you want to get this patient to is someone who can perform, and here's the new word alert, pericardiocentesis. I'll do my best. Pericardiocentesis. It's about 5, isn't it? Pericardiocentesis. My wife hates playing Scrabble with me. I'm like, no, it's a word. Look it up. It's a word. I will hang on to some of those tiles forever waiting for that perfect word. Pericardiocentesis. So what a pericardiocentesis is they take this big long needle and they run it substernal, meaning under the sternum. They find the xiphoid process and they angle toward the clavicle, the left clavicle. So they're aiming this needle toward the left clavicle. And on the end of that needle is a big syringe. And as you push that needle up through the chest, you pull back on the plunger. That's called aspiration. Sucking. So I'm sucking on that needle as I go up, and I'll feel a pop, and I'll get some blood. Stop pushing. Because the next push is going to be into the ventricle. And you don't want that. You want to know something really cool? I can take that big long needle and I can take and put an EKG on the patient. And instead of putting the left leg, the little one down here on the left, if I take that electrode and I wrap it around that needle right up there at the hub, and I watch my heart monitor, if I touch that heart muscle with that needle, I'll get a big spike on the EKG, and I'm like, that's far enough.
Same thing when they're doing the.
It's pretty cool. That,
I watched that.
yeah, they tie it to that, and they know if they hit the heart.
So you don't want to mess that up? Or
No, you don't want to mess that up.
whatever.
That'd be an idiopathic, not an idiopathic, but a
I can't even pronounce it.
iatrogenic. That would be an iatrogenic injury. Yes. Very good, Starrett. You've learned something today, haven't you?
Dr. James putting that guide rod in and then hit the heart and the monitor was like, he's like, oh, I'm there.
I'm there. Oop, I'm there.
He said that. I was like, dude, we're in a serious situation.
Oop, I'm there.
He freeballed it too, like,
I just dug in.
or eyeballed it, whatever. He was freeballed.
Freelanced. He freelanced.
What's that again?
Pericardiocentesis is to remove the buildup of fluid that's in the pericardial sac. It relieves cardiac tamponade.
So the pericarditis and blunt force trauma, are those the main two?
Causes of cardiac tamponade?
Yeah.
Yes. Infection or blunt force trauma. Or iatrogenicity. Somebody's jacking around in there and they shouldn't be. Like with open heart surgery. You have open heart surgery, they got to cut the sac, they put it all back together, they put you up in ICU, and then the ICU nurse calls the doc at 3 in the morning and said, I've got muffled heart tones. What's happened? Well, something started leaking in there, and they have to go back to surgery immediately to stop the bleeder. Now, if this one doesn't sound bad, you're in the wrong class. Thoracic aortic dissection. Leakage from a traumatic aneurysm of the portion of the aorta that lies within the chest. Do y'all remember me way back in August talking about a ligament that hangs off of the vertebrae that runs down and attaches to the aorta and hangs it up so it doesn't kink? It keeps the arch in the aorta. It's called the ligamentum arteriosum. Remember that, Luke? So it attaches at the spinal column. This ligament goes down and it grabs the aorta and holds it up. It keeps that arch in it. Keeps that arch in it.
So how does it not just like clench it?
Well, it's not like a rope. It's just built into it. I thought it was up here. There it is. Ligamentum arteriosum. See it? See that ligament?
Yeah.
Well, that goes through and it attaches to the spinal column. Third collision of the automobile accident. Car hits tree, body hits car, organs hit body. So that heart's moving forward at 70 miles an hour, and then that ligament just rips off the top of it. And that results in number 10, thoracic aortic dissection. Depending on how big the tear that is, depends on how fast they're going to die. They could die immediately. They would, what we call, and you know the word for bleeding to death rapidly? Exsanguination. Very nice. Very nice. Thank you. Exsanguination. Or they would die over the course of the next few hours if the hospital did not pick up on that this guy's leaking. Have you heard enough today to realize that chest injuries, if there's a high index of suspicion, they should go to a trauma center with thoracic capabilities quickly? You need a thoracic surgeon. He or she is your best friend here. Okay, let's finish it out and finish the day out by number 11, number 12. You guys have been hammered today with information. I'm going to give you some reprieve tomorrow. So if you're not dealing with the food drive and you're in staging area here in the classroom, I may or may not rotate in and out, and I have a in-class deal we can do here in the classroom. So to reinforce this trauma stuff. So you'll be busy, won't be bored just sitting around. So go ahead and bring your computer and your laptop or whatever you need to look up stuff, because we're going to be looking up stuff tomorrow. And Regan's like, I get a day off tomorrow. Unless you, huh?
But Thursday we got lab, right?
Yeah, Thursday we have lab. Unless you want to film us at the food drive. That probably wouldn't be copacetic, would it?
It's not. It's in fact what's his name?
Invasive or something, isn't it?
Jim something at the Cowboy guy.
Yeah, yeah.
That's his job. Prospecting that he over there.
Yeah, he'll be like, what are you doing over here?
Like a Spider-Man thing for me? Like point at each other?
Yeah, yeah. Last two. Number 11, number 12 go hand in hand. I don't really know how you could have a myocardial contusion and not a pulmonary contusion. And that's just simply bruising of the tissue. Contusion is a bruise. That's bruising of the lung tissue and or bruising of the myocardial tissue itself. Just as a heads up, there's nothing much we can do about it. Depending on the extent of it, depends on what they'll do in surgery. If I've got the heart contused, am I worried about the heart bleeding into that sac? Sure. If I've got the lung bruised, am I worried about it bleeding into the pleura sac? Sure. But typically, the damage is how big is the bruise. The severity is how big is the bruise. On an EKG, the bruised area of the heart will show up like an infarcted or ischemic area of the heart. So not that we do 12 leads on trauma patients, but maybe late in the assessment, if we did a 12 lead on the trauma patient, we could see the area of bruising, because we would see ST changes, because it's damaged tissue, right? This gets really weird in some cases, because a little old man's driving his car to the post office, he gets chest pain, he runs off the road and has a wreck, strikes his chest on the steering wheel. You don't remember troponins? Troponins are proteins in the blood caused by damaged heart tissue. In these patients, if the heart tissue is damaged due to trauma, we still get troponins. And so it makes it a very challenging thing. If I put a 12 lead on him, I'll see changes. Do I take him to the cath lab, or do I take him to open heart? Is it trauma or is it medical? Or is it both now? Is he on a blood thinner or not? Once again, he pulled the wrong Uno card. He got caught. The game of life, not in his favor today. I wish I'd have never came up with that analogy yesterday, because ever since then I'm like, life is nothing but a Uno game. Game of Uno. Uno. You like Uno?
It's all right.
I cannot stand it.
You must always do those plus four.
I cannot stand it. There is absolutely no skill involved in that. Well, I guess there's a little bit, but it's all hatred.
Have you ever played a spicy Uno?
Spicy Uno? It sounds fun.
You like operate.
Do you have to drink when you play that?
No. That's
Can you drink when you play that?